And if you want the replay of these webinars along with a full word-for-word transcript and screenshots and everything, it's pretty slick. You want to join a replay club. It's only $10 a month, and you get access to the replay. Because the live version is free, the replay we charge a little bit because of the bandwidth, etc. So it's under here, Products, Webinar Club. I wanted to bring up the website real quick to show people. Our little team is growing. If you go to Home and then About, we have little blurbs on each of the team members. So there's me and Alicia and Boyd. Michelle helps us with our affiliate management program. Abdi, he's the one manning the Twitter chatter under the CCO name. And Ruth, she's on there helping too. Ruth is a administrative assistant. She's been doing great, and she's a graduate of CCO too. So we'll have to get her on next time. And there's actually a new person, Sylvia, who's always kind of helped voluntarily. So we decided to give her a job, and she was recommended by Alicia, and she's helping do customer support. So we're growing, and I'm just thrilled because I love my team, and it allows me to focus on doing the recordings, which I need to stay focused on. So, all right, let's see. Okay, so we have our first poll, and this is how many webinars for you?
So again, how many CCO webinars have you attended? Is the first choice, is this your first webinar, your second webinar, or more than 5? And you should see a little voting box there. And we've almost got everybody voted here. I'm going to end the poll in 5, 4, 3, 2, 1.
I'm rooting for more than 5.
So
woohoo! First webinar is a good thing too.
There you go. Very good. So 45% first webinar. So that's really interesting because I see a lot of similar names, but I guess I'm just thinking we have so many repeat customers, but we do have a good mix. So great. Well, welcome newbies, and I hope you find what you're looking for in the webinar. And we're very open to suggestions. So you can always email Laureen at codingcertification.org, and I'll be happy to entertain suggestions. All right, so next, this is my reminder slide to stay to the end, and that's where we'll go over all of our new updates and giveaways and special coupons and all that good stuff. Okay, this is the one. Are you certified? Yes or not yet?
So another chance to vote there again and share.
Oops.
Ooh, lots of them studying. Good.
All right, so Alicia is going to interview Jane on we just decided, and this is another one of Boyd's great ideas, is why don't we highlight students so that prospective people on the call can hear how they've used the CCO programs. We don't have a picture. She said the only thing she had on Facebook was a picture of her cat. So,
Jane, let's start out with a little bit of your background.
Okay, I trained as a nurse, and I went ahead. I was a medical assistant. I had X-ray and lab, and I worked in physicians' offices. And then as life got on, I got married, started having children. And I realized that a lot of my time was away from my kids, and I didn't like it. So I was always being asked to help in the business office and whatnot. I also have a degree in business from Portland State. And I realized I like this coding. I like the insurance part. This looks like fun, but it's a lot of work and a lot of time. And so when I was coding, I just up and said, I'm going to start coding from home. I was kind of laughed at, well, what's going to happen? I found in this area, nursing home providers really needed someone to do their billing and their coding. So I started doing that from home. I was able to be around my kids, which was wonderful. And it just really worked out. And then I thought, well, I really should get certified so I know what I'm doing. So I went and I took a course through Portland Community College, and it was at the time when they were just doing online courses, and it was not very well planned out, and many students were frustrated. We finished the course and didn't feel like we knew what we were doing, and this was back in 2004. So I did learn things, and I kept doing what I was doing. And I would actually get called to go out to other clinics. They needed someone to fill in, and that was fun. It gave me variety of going to different offices. But I really didn't feel I was doing my best work, and so I went over and I took the coding at the community college again, and they had a lady who is the head coder for the Oregon Health Sciences, and she did a great job, but still things were not meshing for me. And so I was looking to, I didn't want to have to go through another program, but I was willing to do that. And online, I found Lorraine's Blitz videos. They just made everything clear and put it together. It was just wonderful. I had the confidence, and I studied, and I went and I took my certification test, and of all the little nuggets of information that came, the pearls of wisdom on how to eliminate certain answers, and it was just fantastic. Because of the Blitz, I passed with ease once I got over being nervous.
Right. Yay, and congratulations on that.
Jane,
Thank
you're
you.
doing the medical terminology and anatomy course with us right now, aren't you?
I am.
And what do you think about that? Do you think that's going to be beneficial, or what made you decide to go ahead and take that since you were already certified?
Well, I'm looking ahead at ICD-10. And I know they're going to be more in depth of knowing the information, and I want to brush up because it's been over 35 years when I went through my medical assisting nursing, and I just want to be sharp. So I actually took the course to AAPC. It was not challenging, and I hope nobody is affiliated with AAPC, and I don't mean to hurt your feelings, but my daughter would laugh because they would be doing their little speech about it, and I'd be up in the kitchen washing my dishes, and I'd come back and take my 10 little question test. It was not challenging. I wasn't learning, and again, I saw Lorraine's program. I thought, well, this is going to be worth it, and it so is. It's fun, the games, the way you present it, Lorraine, it really just sticks in your head, and you hit the highlights, and it's a lot of information, and even when you take the test, you got to know what's in that chapter because the 50 questions can come from anywhere.
Yes.
Mm-hmm.
But yeah, you present it. It's wonderful, and I'm learning a lot. And I don't get up and wash the dishes when I'm watching your video now.
Well, that means a lot to me because I didn't realize till tonight that you had a nursing background and you're taking my medical terminology course. So I'm honored that.
Yeah,
brush up.
she's an LPN.
Yeah, that's great.
That's great to know that you're enjoying that. You had talked a little bit before we got started about some of the hints and things to do when you were testing that seemed to be very helpful. Can you share some of those?
Certainly. I feel, of course, you're going to study hard and get ready for the test, and you're going to know your stuff. You go through Lorraine's Blitz, and you use these highlights of eliminate certain answers. When you get to take the test, there are going to be individuals that have not passed it before. They're going to be talking about it. They're going to moan how difficult it is. It's like when you need to get your wisdom teeth out, and everyone needs to tell you the horror story about the oral surgeon and what happened to them, so you'll really get freaked out. Got to let that go. When people start talking about that, just think to yourself, well, that may be true for them, but it's not for me. I know what I'm doing. And get in there and take a deep breath. And don't look up at anyone. Last thing you need to do is see the lady biting the erasers off the end of her pencil. You're going to be fine. Because my experience, I went in and I had listened to these individuals out there talking about how they had failed and this and that, and I was nervous. I actually thought I was going to have a stroke or something and fall on the ground. I couldn't breathe, and it's like, breathe, Jane, you're fine. And then when I start taking an hour into the test, I realized I can do this. I have the tools because of Lorene and the Blitz. You know, this answer's not going to work. This is not right. This is the information I need to extract. And I was fine. And so I went ahead and I finished the test, and I was done in 2 additional hours, and I went back and I redid the first part. So I was done in 4 hours, and I passed easily. But have
That's
confidence
fantastic.
in yourself.
That that I think helps a lot of people not to hear the negative out there, because that seems to be what the traffic is, the negative, and you don't hear as much about the positive. You also shared with us before we got started some information about that first job, getting your first job, and the attitude to have and stuff. Can you share some of that with us as well?
Show your confidence. You know, believe in yourself. You've gone through these programs. You are smart to get through. And when you go for your job, if they ask, well, do you know this program? Are you familiar with Epic or whatever may be the medical records or the way they do things? If you don't know it, tell them. But let them know you're willing to learn. That's the key. Because believe it or not, I've ran into some individuals who'll say, well, I don't know that and I don't have to learn it. Well, if you want the job and if you show the people that you're willing to learn this, and even if you don't get that position, I suggest you go out and research what they were talking about, because the next interview they may ask you, and if you have more information and let them know that you are looking into this, it may just be your way into the door.
That's great. Jane, I really appreciate you coming on the webinar and sharing your information, because I think it's going to be real helpful to people both that have been coding and those that are studying to pass their test, and those that are getting ready for ICD-10, like you mentioned, and not being scared of ICD-10.
That's right.
Thanks.
Thanks so much,
Well,
Jane.
I'm so honored. Thank you. And the last thing I can leave is have confidence in yourself. I mean, you've gone through the programs, you know the information. You just need to know how to put it out there, and Lorene's program will show you.
Thanks, Jane. And hopefully you'll get on the discussion board, and you can probably be one of our people that go to for motivation.
Well, I'm happy because it's an awesome program, and I'm so thankful I found you. I really am.
Well, thanks. And she was Jane was sharing with us earlier that she talks about us so much at work that they asked if she was related.
Yeah.
So thanks, sis.
Well, thank you.
All right. So we had another poll to see if you were an AAPC or a HEMA person. We might have to change that in the future, or say both, because some people are dually oriented. So if you can take a moment and do the poll, are you more aligned with AAPC or a HEMA? And if neither, I guess you don't have to vote.
It looks like almost the same amount are voting, so we're
Yeah,
close.
and
Right to
people with iPads, you're unfortunately not able to do the polls, we have discovered. So sorry.
and iPhones. We have a confirmed iPhone person on the webinar tonight.
Great.
That's pretty cool. Okay, great. So we're going to close it in 5, 4, 3, 2, 1.
Boyd had to throw that in there because I told him, I said, nobody watches webinars on their phone. He goes, yes, they do. So 77% AAPC and 23% AHEMA. Okay, great. So that's interesting to me because, you know, a lot of people want to get the CCS, which is more of an inpatient hospital coding one. And we used to teach in my former life, let me put it that way, the CCS prep course. And we will probably be doing that in the future, not the very near future, but right now our focus is on physician and outpatient based. So the CPC and the CCSP are really what we're catering to.
Which is a good point, that with people, you know, keep checking in with us, because we're just expanding so quickly. We'll be offering new stuff in the future, I think.
Yes. Yep. And with this great team that's building, I can focus on creating the content and they can focus on the support, and it's all good. All right, so let's get into some content. One of our students had asked to review neoplasm coding from the ICD-9 manual. So I think this link will bring me to that page. It's opening over here. So what this is, and it does look like someone chewed the corner. That's my kids. I was working on this page and they came over. Can I help you color? But at any rate, if you have your ICD-9 book handy, this is in the index if you go to the ends for neoplasm. The first thing you want to remember about cancer coding or neoplasm coding is the fact that really you should not start with the neoplasm table. And this was kind of new for me. I had actually been teaching a couple years before I actually realized that you should look for the main term in the document that you're coding, like melanoma or whatever. You go to that first. 9 times out of 10, it will direct you to neoplasm and the table, but always start with the main term that you're trying to code and let the index direct you to the neoplasm table. So once you come to the neoplasm table, what I want you to look at first is these columns, okay? So there's, in neoplasm, here you go, Jane, here's medical terminology, right? Means new growth. It doesn't mean cancer. It could be, but it means that there's a new growth. So we see here that there's 3 types of malignant cancers: primary, secondary, and cancer in situ. The primary type is it's a spreadable type of cancer. And secondary is where it spreads to. So you'll see in the documentation phrases like with Mets. So maybe they had breast cancer with Mets to the liver or with Mets to the lungs or something like that. So the primary cancer would be the breast and the secondary cancer would be the lungs or the liver. Okay. Cancer in situ is a cancer that's not the spreadable type. It's kind of encapsulated. Another instructor tells her students to think of an egg. It's like the yolk in an egg. So it's encapsulated. It's not going anywhere. Then we've got benign neoplasms, which is self-explanatory. Uncertain behavior. They're not sure. They're watching it. And then unspecified. They just know that it's a neoplasm, but they don't know. A lot of times coders will wait for the path report to come back to code it as primary or secondary or whatever type cancer it is. But sometimes they don't know, they don't plan on documentation coming back to code from, so they code it as unspecified. So once you determine what type of cancer or neoplasm you're dealing with, that's the column that you're going to use. So let me scroll down a little bit here. So let's just take abdomen, and I'm just going to use the top row for illustration purposes. So if the cancer started in the abdomen, if that was the primary location, you're going to pull from this first column and code it the 195.2 because that's the primary column. But let's say it spread to, I'm just trying to stay on the same page here. But if it spread, if it was a secondary cancer of the abdominal pelvic area, let's say, you're going to code from the second column, 198.89. And that's how easy it is to pull from these columns. Now you still should turn to the tabular and look at the code definition and confirm that you've got the right code that you're looking for. Don't just code from the table. What gets confusing with secondary cancer coding, and you might want to copy this into your book. For those that are in the replay club, you'll get a copy of this PDF here, is secondary cancer coding. How do you handle that? If a patient's coming in for treatment of the secondary cancer, that's going to go in the first position on the claim form. Okay, so you're going to pull from the secondary column, that's going to go in the first position. Then the next logical question is, well, since it's a secondary cancer, where did it come from? Where did it spread from? So that is going to go in the second position on the claim form, the second diagnostic slot. So if the primary cancer is still active, then you're going to pull from the primary column. It's just going to go in the second position. If it's been excised and it's not under treatment, it's history of, you're going to use a V code. Maybe they had a mastectomy. So then it's going to be history of breast cancer. And now you're treating liver cancer. So you pull the liver cancer from the secondary column, and for the That goes in the first position, and then in the second position on the claim form, you're going to code the V code for history of breast cancer. If you don't know where it metastasized from, because maybe you're coding for radiology and they don't know, they're just doing a brain scan or a liver scan, then they have to use 199.1, which I have circled here. That's the unspecified primary site. Okay, so that's how you handle the secondary cancer coding. Now, another thing that I always like to let my students be aware of is this in the notes section. If you look at number 2 here, it says sites marked with the asterisks should be classified as one of two things. Either it's a malignant neoplasm of the skin or it's a benign neoplasm of the skin. Now, it's malignant if it's a squamous cell carcinoma. So if that's what's documented, you consider it malignant neoplasm of the skin. If it's an epidermoid carcinoma, same thing. It's a malignant neoplasm of the skin. Now, if it's a papilloma, then that's considered a benign neoplasm. So make sure that you have this marked up for the skin ones. Let me see if there's any starred ones on this page. No, sorry, I don't have any examples, but it would be an asterisk, and you know, because sometimes it'll say abdominal. It's like, okay, are you talking about the skin of the abdomen? Are you talking about internal organs of the abdomen? So that's what the star would help you understand.
Do you go over this at all in the Blitz course that is being asked by
Yes,
Linda?
that's I do cover that in the Blitz because I do feel that is a question that you'll be asked on the board exam, especially the secondary cancer coding.